Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have David Martinez back in here with us today. David was one of our very first hiatal hernia patients who came in here that has had true, lasting success after, what, 12 treatments, wasn't it?
Yes,
12 treatments, and his goal was to eat a double jalapeno pepperoni pizza, and he tells me he's eating triple jalapeno pepperoni pizzas now. Have you had any heartburn since 2013 was last time you were here, 5/2013?
Yes, that's correct.
So that's like 2 years.
I've had no heartburn.
Almost, exactly. That's wonderful. No more acid reflux at all. Great.
No medication.
And today he's coming in for vertigo, and he's gone to the medical doctor, and they gave him some medication, and it's caused him to have a lot of headaches as side effects, pretty severe headaches too, right? And they can't really explain why he's got vertigo, so we're going to evaluate his spine today and see if he's got an atlas misalignment or occiput misalignment causing that vertigo, and then we're going to adjust him and let him tell his story. So let's take a look at your posture here first, David. Sure. Let's have you face the mirror for me. Okay. It's been so long you forgot what to do. Okay, so let's have you flex your head forward and backwards with your eyes closed for me. Yeah, so he's got a little bit of problem going backwards. Do you feel that going backwards, tightening up? Yeah, now neutral. There you go, good. He's got a little bit of a forward head posture, and his head's also translated to the right on the x-axis. Got a little bit of rotation. He works out of town a lot, so he's been sleeping in a lot of hotel beds, probably in pillows that aren't the best in the world for you. Lives here in Houston. Lucky him. He's been an excellent patient, and he referred his wife and family in here that we're now taking care of as well. And they're pretty happy, aren't they, David?
Yeah, sure.
Yeah, good. Okay. We appreciate David. He's done a great job spreading the word about chiropractic and Advanced Chiropractic Relief here in Houston. Okay, David, I got you figured out. Did you see what's going on? Your head's forward again, and it's translated over to the right. So, and you see the little tilt right here? That means your atlas is slipped off to the right, so that's why your head's off that way.
Okay.
So what I'm going to do first, we're going to decompress him after a couple of years. Got some new cooler pins to hold you in, so let's lay on your back first. You have any accidents or trauma since I saw you, have you? Okay. He's just got this vertigo as he was driving down the highway, right?
Right, yeah.
In Louisiana, and it got really severe, so he went to see his medical doctor about it, and they gave him some medication, and the medication really didn't help the vertigo at all, did it?
No.
And then he started getting severe headaches as a side effect of that. And all of you guys out there that have had problems like that, vertigo or dizziness, any problems really, and you get medications for it, there are a lot of side effects to those medications. We don't ever tell our patients to discontinue taking medications or to take certain medications because that's not really our scope of practice. What we try to do is find the underlying cause of the problem and then fix that. Oh, your right leg's way short today too. Okay, so we're going to decompress him from his occiput all the way down to his sacrum. So take a nice deep breath through your nose. There you go. That's it. Boy, you feel your skull separate from your first vertebra up there? That was perfect. You feel it all the way down too?
Yes, I do.
Good. Okay, so we're going to leave these legs up here while I adjust his atlas with the Palmer diversified cervical adjustment. Drop it right in my hand. There it is. Perfect. There we go. Boy, you're going to be moving better tonight. So, if you usually look up a drug and you look up its side effects, you'll see that the side effects are about 3 pages long versus the one good effect it's supposed to have for you. Let's come over this way. The funniest one I ever saw was a sleeping pill commercial on television that said one of the side effects of taking this sleeping pill was insomnia. Thought that was kind of strange, but true. That tightens up a little bit right there in your lower back. You see his right leg's coming up a little short. Did you feel that a little bit right down here? Yep. So we're going to adjust his right sacroiliac joint first. Now this is the first adjustment he's had in 2 years. There we go, good. And then I'm going to adjust his sacrum, which is the middle triangular shaped bone right in the middle of his pelvis. And then we're going to do his left sacroiliac joint. There we go, good. Now I'm going to get straight down on L5 in the Z-axis. And L4, you're going to notice the angles on my arms change as I move up the lumbar spine. Now we're on L3, that's probably the sorest one. There's L2, that's also sore. And there's L1, good. And I'm just going to put some pressure in here as you exhale. Here we go. That's perfect, good job. Put your head down a little bit here. Now this area that I'm adjusting right now is the area that we corrected on him a couple of years ago with his mid-thoracic vertebra and lower thoracic vertebra where they attach to the ribs. And that was letting his diaphragm get weak, and that's let his stomach slip up through the diaphragm and cause the acid reflux and hiatal hernia symptoms. So when we treat people for acid reflux or hiatal hernia, we're not really treating them for that disease itself. We're actually treating why that happens in the first place, which is all mechanical. It's with the thoracic spine, the rib cage, the diaphragm, the muscles in the diaphragm and the hiatus itself being strong enough to hold the stomach down where it's supposed to be in the lower cavity and not slip up into the esophagus and secrete acid into the esophagus, which is what most hiatal hernia patients feel. But everybody feels different symptoms with that. Some people get a fullness in their sternum or underneath their sternum and a stomach fullness, and some people get acid that goes all the way up into their throat. They get nausea and throw up with it. They get severe chest pain sometimes, which I had when I first had one. That's how I learned how to take care of it so well. I had one myself. And after medical care had failed miserably to help my hiatal hernia, I went to a chiropractor who knew how to treat that and got mine treated. And it's been well ever since, so I specialized in learning how to take care of that myself, and we get people from all over the world flying over here to see us for that treatment. In fact, we have a lady here right now from the UK who flew over this week. She's staying right across the street, the Hyatt Regency, North Houston, which is on our website, by the way, in the About section of Houston. There we go. They give our patients special discount rates, and just right across the street, walking distance from our office, so it's nice to do. That felt a little easier, didn't it?
Yes, it did.
Good. Okay, so he hadn't been here in a while, so I'm going to take it easy on him today. I'm not going to do the turbinator on him first thing. I got a much more powerful turbinator. It's a lot deeper, but I'll save you the pain on that one today. We'll do something to stimulate your blood flow and get your muscles relaxing for you. We're really proud of David. He's our first big hiatal hernia success here in Houston that's lasted so long, 2 full years without having any reoccurrences of his acid reflux or hiatal hernia. You're pretty much eating anything you want, aren't you?
Yes, I am.
Yep, good. I'll let you tell that to him afterwards too. For those of you who do suffer from hiatal hernia or vertigo, everybody's always calling here or emailing us and wanting to know if who does this same technique in New York or Atlanta or LA or San Diego, and quite honestly, I've developed pretty much my own technique from my education at Palmer, as well as my postgraduate education in biophysics and biomechanical physiology and the mechanics of the spine and nervous system and the physiology of the nervous system and neuropathophysiology, which is what causes things to not function the way they're supposed to. And that happens after the vertebra's been on the nerve over a period of time and interferes with the transmission of those nerve impulses to your organs, muscles, tissues, and cells, and whatever's at the end of those nerves doesn't function the way it's supposed to, and that's disease. That's the hiatal hernias, that's the gastritis, that's the ileitis, diverticulitis, you name it. now his legs should be even, which they are, and they stay that way. Did that feel a little better that time coming up?
Yes, it is.
Didn't tighten up as much? Okay, let's have you sit up and face towards your knee now, please. That way. There we go. Perfect. And just look straight ahead for a moment. And we got some email from a lady the other day that said she'd been going to a chiropractor for 4 years. Should she be feeling any better yet? And you know, we just want you to know that we are ChiroTrust members, which there are ChiroTrust chiropractors all over the country, and we are committed to short-term treatment to get the patient out of pain and out of their symptoms, and then let them go about their own lives and live their lives. Just like David here. We didn't bother you for 2 years, did we? And that's the way it should be. You need to get out of having your problem. Hopefully we're going to get rid of David's vertigo pretty quick and he can get back to living his life just like he was. Excellent. Good. Would you mind sharing with our YouTube video subscribers and viewers what your experience has been, what brought you here, and how you're doing now? And
Sure. In September of 2012, I started experiencing acid reflux. At the time, I didn't know what it was.
Right.
I went to the ER thinking I was having a heart attack.
Right, I did that too.
And all the signs came back, it was negative, I was okay. So they gave me some Nexium to take for acid reflux. And for 8 months, I was taking medication, seeing doctors, and no one really knew what was wrong or how to address it. And then...
Did they ever recommend surgery to you?
They were close to it. At one point they said, we're going to give you 6 months of medication. If that doesn't work, we need to seriously consider surgery. And then around that time, I was coming back on a trip from Louisiana, and I stopped to pick up dinner one night. And as I was sitting in my car, I just started praying. I said, God, you know, please help me. How we can cure this. If there's
Lead you to
any
the
hope
right
for me.
person to help you.
And it seems like that was just 2 words that came into my head. And it was Houston Chiropractor.
There you go.
And I immediately just picked up my phone, I typed it into YouTube, and I came across your video with Amy Brooks.
That's incredible.
Was it Brooke?
Yeah, Brooke Adams, the wrestler. Yeah,
So
she has
I saw that video, and I scheduled my appointment that next Monday with Renee.
Yep.
Came in and been ever.
Well, that's who brings all of our new patients in here too, by the way, is God. He's the one that does the healing. I'm not the healer. He's the healer. He just uses me as a tool and instrument, but we're happy to be used. Thank you for sharing that with us, David.
Appreciate it.
You're welcome. Thank you. And come over here and we're still going to shoot you still.
Okay.
We didn't forget how to do that. Alright, so let's check and see if your head's on any straighter. Even your mom used to put your head on straight now. Okay, let's flex you forward and backwards again. Yeah, he's already got a little better extension. Then go back to neutral. But he's still a little bit right lateral, so we're going to do exactly the opposite of that. We're going to lift his shoulders up, pull back, flare these hands, palms forward. Then we're going to bring your head all the way back here and translate you to the left. And I'm going to have you tilt left here too. There we go. Now I'm going to adjust his atlas on the x-axis while he's in a mirror imaged posture, which will send messages right up here. I'm going to adjust these occiput straight vertical as well to get it off the atlas. There we go. Okay, now relax that for a sec. And let's have you flex forward and backwards again. Yep. Now neutral. Much better. Take a look at that. See, isn't that centered right now? Shoulders are level now, equal distance here. Does that feel a little more stable to you?
Yes, I do.
If you were to close your eyes, are you getting dizzy at all?
No, not at all. Earlier I was feeling like I was being pulled forward, but now I'm still.
Yeah, you're good now. Good job. All right. This is your Houston chiropractor and one of our favorite patients of all time, David. And we'll see you next time. Thank you.
Thank you,
David. All right.